And still on health matters, but now in Southern Africa, Namibia's Ministry of Health and Social Services has launched a comprehensive plan worth 16 billion Namibian dollars, about 1 billion US dollars, to enhance the nation's public health system. President Hage Geingob made the announcement while speaking at the inauguration of an emergency unit at the country's largest state-owned hospital in Windhoek. Geingob said the plan envisions the execution of impactful projects and interventions within the public health sector nationwide. He emphasized the government's commitment to the public health sector, underscoring its high priority and substantial funding. And to talk about these is a Namibian journalist who joins me live, Dwight. Good afternoon. Glad to have you join me.
Thank you very much, and welcome to the viewers.
All right, Dwight, how do you perceive the impact of the comprehensive plan launched by the Ministry of Health and Social Services on the overall public health system in Namibia?
Well, firstly, it's a known policy now, probably for the past 10 years. What I mean by that is ultimately it forms part of the presidency's Harambee Prosperity Plan, HPP2. Also, it's a development up from HPP1. But this particular development the announcement comes through with this new facility that was upgraded just in this particular last few months, which the president unveiled in this particular week. You've got an indication that halfway through the ministry's financial year, which is April to March of every year, April the previous year, March the new year, it's within its scope. So the particular question in terms of this drive is, yes, it's within the same financial year, and yes, it's supposed to be what the ministry has to do. The impact is still something. It's not major, because what about the other regions in the country is the first question that many analysts would ask. And secondly, is it a question of, is this going to be every year's particular development that we see through a new regional or a new major medical facility being upgraded the same way that this particular facility in the capital was upgraded?
I hear you, Mr. Links. Just speak to me about the specific projects and interventions included in this plan, for instance, and how you think they will address the existing challenges in the public health sector.
One of the expansions that the president gave is that this does also mean that the same development would roll out for the other regional facilities. So I'm talking about hospitals and clinics. The current picture, if any person looks at Namibia's medical system, is that we've got a hybrid system, which is public and private running right next to each other. The big discussion obviously would be whether or not the average Namibian would want to go to a public facility versus a private facility, or vice versa. And the discussion is always, which also starts building up into whether or not Namibia actually has universal healthcare, which is another concept in its own right. Now, this particular concept actually puts in a little bit of a burden on the state, because the state now has to upgrade the facilities which we have inherited since our apartheid days. Many of these installations and infrastructure is actually what was just inherited. So when you inherit, this ultimately means that there is the convenience of just upgrading, but how often do you do this? And ultimately, what does it lead to? Does it lead to new jobs? Does it lead to more people being serviced? Or does it also help with more of keeping the Namibian nation healthy?
All right, Dwight, if you can, could you share with me some, of the government's long-term vision for the public health sector, for instance, in Namibia, and how you think this plan aligns with it?
It actually aligns pretty well. There is the policy document that I mentioned at the start, known as Harambee Prosperity Plan 2, HPP2, which is a direct policy document by the presidency. Outlines it in the third pillar. Now, the document has 5 pillars of this critical sectors and which impact Namibian socioeconomic platforms. And Pillar 3 looks at social progression, wherein you find the upgrading or the maintenance of the health sector in the country. And then it bounces over to Pillar 4, which is that of infrastructure and maintenance of said infrastructure and keeping it in the same adequate condition to benefit Namibians, which is basically you can say it's two birds with one stone that are being tackled in terms of this particular direction. However, the announcement that came through in this week, you could look at it as a scenario of either the president who comes from the ruling party, SWAPO, it might be putting in a little bit of a good, position, a good PR exercise just before the election year or the presidential election year of 2024, which is next year. And but once again, many detractors, many analysts would say, but we've known since Namibia's independence that the government or the state, whichever party it might be, aims and has made a commitment to continuously invest in human capital development, which is our education and health facilities, and that the two of them get equal attention, not equal in terms of budgetary allocation, but equal attention of being the two particular important drivers for Namibia's socioeconomic development going ahead.
All right. Thank you so much for your time. My journalist from Namibian journalist, Dwight Links. Thank you so much for your insight.
Not a problem.